Hey everyone, I'm Dr. Kira Lewis. I'm a naturopathic physician, and today I wanted to chat with you guys about the Proov progesterone test strips. They sent me a sample pack to try out, so I'm just going to take a moment here to talk about the test, my experience with it, and then answer any questions you guys might have about it. So, Proov is an at-home urine test strip. It assesses a progesterone metabolite, so progesterone 3-glucuronide. I'm gonna pronounce that wrong. It's PDG for short. So the urine PDG concentrations are high enough, so they measure 5 micrograms per mil in order to turn the test strip positive. So the urine level of PDG confirms that yes, ovulation has happened that cycle, but also it's above a healthy threshold to maintain a pregnancy at the early stages. So to do the test strips, they look like this. They're just the little, like, typical LH or HCG test strip. The only difference being that one line is positive, 2 means negative. So my control, you're supposed to do it earlier on in your cycle, like right at the start. I did mine a bit later, so it's not as clear as it should have been. But there's the 2 lines, and then my 3 tests. You can see the single line on all of them. I did my first one 4 days after I suspected ovulation had happened, and then I had 3 days in a row of positives, meaning yes, ovulation happened that cycle, and then I had a healthy level of progesterone. So you collect first morning urine to make sure you get a nice concentrated level of PDG in your urine. But yes, super easy to do, and relatively clear results. When you first did the testing on the days that I was actually looking for progesterone, it was a little unclear because you can have 2 lines, one being very positive and then one kind of like a faint gray. They go into detail on this on their website, and that still means that you have a positive level. So a little confusing, but their website was a really good resource if you needed any clarification during the testing process. So this is pretty neat. It's an at-home simple urine test to tell you that yes, you've ovulated, and yes, you have enough progesterone to maintain a pregnancy early on. Inadequate progesterone levels during early pregnancy is one of the many factors that can contribute to pregnancy loss. So if we can screen for this and correct it early on, we can support the mother and the growing baby with a simple progesterone prescription. So this is a simple test for a relatively simple fix. So this test, combined with many other ways that you suspect ovulation is happening, so you're either watching for changes in cervical mucus, you get mid-cycle cramping, so the middle smirts, or using LH strips to detect the LH surge pre-ovulation. So those are all great for detecting or predicting when ovulation is happening, but none of them really confirm that yes, ovulation has happened that cycle. So that's where the Proov test can come in and provide a value there. So you can monitor, yes, it's happened that cycle. This is really, I see a really good clinical use in women with PCOS. So they get multiple positive LH surges throughout their cycle due to the hormonal imbalance nature of the condition, but we don't really know if they ovulated, even if they're getting these positive LHs. So aside from doing a blood test, so the serum progesterone, this is a demographic where I see a really good application. It's a simple at-home test that they can use to monitor their cycles and see if they are ovulating that cycle. So serum levels of progesterone, they detect if ovulation has happened within a cycle, but the cutoff, so you want a minimum of 10.5 nanomoles per liter to say yes, ovulation happened. However, heading into pregnancy, you want at least like greater than 30 nanomoles per liter. So there's a little bit of discrepancy between yes, you ovulated or yes, you have enough progesterone to head into pregnancy. Not that your body isn't going to ramp up from that 10.5 if you are on the lower end, but it just bodes better if you do have a higher progesterone, more robust progesterone heading into those early stages. So the Proov test, yes, it confirms ovulation, but it also tells you that yes, you have a good level of progesterone to begin with. So who wouldn't this test work for? So on their website, Proov states that some studies show that 7 to 12% of women do not metabolize progesterone into PDG at high enough levels to result in a positive test. So we need to keep in mind that this is testing your urine, so it's not testing specifically progesterone, but it is a metabolite of progesterone. So there's that unknown in between going from progesterone to the PDG that there's going to be that individuality on how good you can metabolize it and actually convert it. So it's a little bit of an unknown variable, and some women just don't metabolize it well, so for them it would just be testing serum progesterone would be the best option for them. So to summarize, I think this is a useful and a well-researched tool to confirm ovulation in patients. It's also really slick and easy to use at home. I think there's great value, especially in tricky cases where you don't really know if ovulation is happening month to month, and it's easier for the patient to test their own urine than going into the lab monthly for serum checks. Yeah, that about wraps it up. Please shoot me any questions you have about the test. I encourage you to check out the Proov website. They've got tons of information. It's really user-friendly. Yeah, I'll put the link to their site in my bio, and I'll also link a couple of the research papers that talk about the urine PTG, the role of progesterone during the luteal phase, and then progesterone levels during early pregnancy, just so you guys have all the researched information to back up what I was just talking about.